All right, hello everyone, and welcome to the Virtual College Exploration for all North Carolina and South Carolina students, sponsored by the Carolinas Association of Collegiate Registrars and Admissions Officers and StriveScan. Thank you all for joining us today. So just a few housekeeping announcements before we get started. You can use the Q&A button on your screen to type questions to our presenters at any time. Your camera and microphone are turned off today so the panelists cannot see or hear you. This is just one of the many different sessions happening, so be sure to check out the full schedule at CACRAO.org. This presentation is being recorded and will be made available within a week at that same website, CACRAO.org. I'd now like to turn it over to our presenters.
Thank you so much. Let me pull up our presentation here. Yeah, well, thank you to everyone that joined us today. We are all super excited to be here and talk to you guys about all of the options in the health sciences. So without further ado, we can all introduce ourselves. Since I'm talking, I'll just go ahead and do that. But my name is Kat Schumann. I'm an admissions counselor at Georgia Southern University. Super excited to get to speak with all of y'all today.
I'm Morgan Coleman. I'm coordinator for admissions events at Francis Marion University, and I as well am super excited to be here and share about our health sciences opportunities with you all.
And my name is Taylor Forbes. I'm an admissions counselor from East Tennessee State University, and thanks for tuning in today.
Hey guys, my name is Sage. I am an admissions counselor at Mercer University in Macon, Georgia. I'm super excited you guys are coming in today. Heads up too, if you are familiar with us and you've worked with a counselor before, you're probably more familiar with Adam. So he's who you work for, but today it's me.
Hi, I'm Robin Morgan. I am the coordinator of nursing student services at Francis Marion University in Florence, South Carolina. So Morgan and I work together. I work with admissions with nursing, and Morgan works with admissions with everything. So it's really good to be here. Okay, so again, I'm Robin, and we are here to talk about opportunities in healthcare. I'm really glad to speak with people who are interested in healthcare. It's been, top of mind since February, March. So I will start with the pre-COVID stats. Healthcare is projected to add over 4 million jobs to the U.S. economy by 2022. This is far more than any other industry in the United States. So if you make the choice to enter the healthcare field, you're making a smart decision for your future. And honestly, if I could go back, this would be the choice I would make. Why? Because there's always going to be a need for healthcare workers. And as you know, the healthcare industry took a huge hit at the beginning of the pandemic, but so did every other industry in the United States. But the hit that they took was less than all the other industries in the United States. So that says a lot about healthcare and the choice that you've made. There's always going to be a path to career advancement should you decide to go into healthcare. Let's say you earn your bachelor's in nursing. If you want to go back to school, you could earn your master's in nursing. You could become a family nurse practitioner. You could become a psychiatric mental health nurse practitioner. If you earn your bachelor's in maybe healthcare administration, you could continue your education and earn a master's in public health. Work as a chief nursing officer. You could work as a chief executive officer at a hospital, or you could head a nonprofit or a public health something in the public health industry. So there are a lot of opportunities, and I'll just speak a little bit. A lot of people just think about hospitals when they think about healthcare careers, but you've got your doctor's offices, You've got nursing homes, home health care services, and a lot of outpatient services that are especially popular right now. You know, your ambulance services, EMTs, paramedics, diagnostic labs, dialysis centers, family planning centers, substance abuse centers, and mental health facilities, and a lot of other places you could work. So it's the possibilities are endless, basically.
I guess we'll touch on this one. I know a lot of students who come into universities are a little wary on what to major in. A lot of the time students come in as bio and then whatever they're looking into, but that's not always what you have to do. Actually, fun fact, a lot of graduate and professional programs within the healthcare field don't require a specific major to get in, just as long as you complete those prerequisites and you do well in them. That's all that they're really looking at. So it's not that you have to do a specific major. You're going to have a lot of options when you're looking at universities. So I know that there's going to be a lot of options. Do something that interests you. Do something that really makes you want to be in college and want to be studying, because that's going to be key. Especially if you're looking to go into administration for healthcare. You don't need to major in biology. A lot of universities offer healthcare administration or public health or something specific, global health studies, so that you're able to still be in that healthcare field, but not necessarily majoring in biology. There's also options if you're looking into physical therapy, occupational therapy, athletic training. You don't have to major in biology or chemistry. You can actually major in kinesiology, exercise science. I know a lot of public health majors are able to do that. I've had a lot of friends who actually went down that path and went into PA school. So it's just important to know your options and to pick something that really interests you, because the next 4 years are going to be tough, especially if you're already planning on going to graduate and professional school. So it's important to focus on something that's really interesting to you, something that makes sense for what path you want to take, and will also knock out a few prereqs along the way. And I know we're talking about a lot of health science specific bachelor's degrees, but again, with those other graduate and professional schools, specifically pre-med, I know a lot of medical schools, again, don't have a specific bachelor's degree they require. So you can actually major in literally whatever you want, not just in allied health. You can major in history and go to med school as long as you get those prerequisites. So it's important to do your research and just kind of look at what programs you want to do and what prereqs they require.
And so we've touched on it already a ton. Healthcare is a huge industry, and there's tons of ways to get involved or to look for different jobs within the industry of healthcare. As Sage was talking about, there are tons of programs you can major in if you're thinking about pharmacy school or medical school or anything within the graduate level or doctoral level within the healthcare industry. But for those of you that maybe you're not interested in going into a program knowing that you're going to have to go get your doctor or your master's right after you get your bachelor's, there are options. So anything from like a dental hygiene degree or radiologic science, nursing is always a good option, or even healthcare administration, something like public health. There are tons of options out there. Healthcare is also, or studying within the field of healthcare can also give you the opportunity to study abroad if you're interested in going to a different country while you're in college, or even double majoring with a language or something like that. There's tons of options for you. And so that's another great reason healthcare can be a good option for you.
So I'm going to talk to you a little bit about non-clinical healthcare options. When we think about jobs in the healthcare field, we think, doctors, nurses, pharmacists, any one of those actually being in the healthcare setting. But those aren't your only options, actually. Some people may be science-minded, but they don't necessarily want to be a hands-on provider. So some of the different non-clinical or, outside of your normal hands-on provider healthcare options we would like to highlight. Francis Marion, we have a popular degree in healthcare administration. It's meant for those who want to pursue non-clinical leadership roles within the healthcare sector. You can find these at hospitals or nonprofits, for instance. And we also have a healthcare executive management program through our business school, which is very popular as well. Some other options are clinical research and health promotion, which are all very important, as we've seen, you know, lately, especially with the COVID-19 pandemic we're witnessing. Georgia Southern has a public health program that extends from the undergraduate level to the doctorate level. And of course, that is pretty much applied healthcare. You're looking at statistics, you're looking at anything that has to do with, you know, healthcare at a public level. You'll find a lot of these professionals in health departments across your different counties and different state and local and also national levels as well. And again, as we've seen with the COVID-19 pandemic, public health is a huge issue and a huge important part right now. Mercer offers multiple bachelor's degree options that allow you to enter research instead of the clinical setting, as well as master's and doctoral programs in both public health, psychology, health informatics, health outcomes, etc. And East Tennessee State University has several options, including allied health, health leadership, health administration, nutrition, psychology, community health, biostatistics, epidemiology, environmental health, and community health. Those are just to name a few. And I'm sure any of us would love to talk to you guys about anything mentioned here. We'll share our contact information at the end. But so just because, you know, you want to be in the healthcare setting, it doesn't necessarily mean you have to be a doctor or a nurse. There are plenty of other options out there for you.
Definitely, and a great way to get into other aspects of healthcare other than clinical, or if you're just wanting to get ready for the clinical aspect and you want to get more into the information or get more on your resume, a great thing to look into when you're looking at different universities for what you want to study is research opportunities. Now, a lot of universities do have research for graduate students, but not as many have it for undergraduates. So if you're looking for that, definitely do your research to see what universities offer that for you. It's helpful for not only boosting resumes for applying to graduate and professional programs, as well as getting a job. It's also great to explore your interests. What are you passionate about? Maybe you go into college thinking you want to study one thing, jump into research and realize you want to study something completely different, and that's what that's there for. It's also great to prepare yourself for a career in research. I know personally when I got into college, I didn't think research was my thing in the slightest until I actually did my own my senior year, and it really changed my viewpoint and what I thought about it. So I highly recommend doing that if that's something that you're interested in. Not only that, but looking at research at the undergraduate level, there's a lot of opportunities for you to earn financial aid that way, as well as get nationally recognized, which is, again, very helpful when you're looking at professional and graduate programs. If anyone's ever heard of the Goldwater Scholarship, which is the highest scholarship that you can receive in the STEM field for undergraduate research, quite a few students have recently won it in past years, as well as this past year, in life sciences, which is health sciences. Not only that, but also within biology, chemistry, all those different fields. So you can receive recognition for research that you do at the undergraduate level, especially within the health sciences. So it's important to know what you can get recognized for, what financial aid opportunities are out there for it, as well as, again, it's just a great way to really explore your field and see what you like to do. I know a lot of universities have these opportunities. I know personally, from our experience, we have a medical school here on campus, so we're able to do undergraduate research with a medical school, which is cool. I know we all have different health science fields and professional programs, so they're able to do research within those schools. So it's important to, again, do your research, ask us questions. We can look into it for you if there's something you're specifically looking for. It's also important to look for different opportunities for you to get involved on campus. I know we're talking about research, but I did want to touch on this because a lot of the times you can do study abroad and research together. So if you're interested in, studying abroad, joining clubs, look ahead of time and see what opportunities there are for you. I know personally we have a lot of opportunities here for, studying abroad and doing medical clinics, doing partnerships with other universities, which I know for a personal fact, Georgia Southern does that as well. I did a study abroad with Georgia Southern, and a lot of these have health related fields or allow you to do research abroad, which is really cool. Another thing to look out for is universities and what they can offer and what part. A good thing to note when you're looking to see what they offer is if they're a part of research alliances, do they have specific scholarships for you? Like I mentioned, there's national ones like the Goldwater Scholarship, but are there any internal? What kind of funding does that university receive? That'll kind of give you a hint on if you can assist on research or if you can actually lead your own as an undergraduate student. So these are just important things to look out for if you're interested in research at all. It's not necessary for a lot of clinical fields, but it's definitely something I recommend, and it's very helpful for discovering where you want to go.
All right, so yeah, such good information so far. For those of you guys that are listening, there are probably some of you that are like, wow, I never knew how many different health options there were. Maybe you were always planning to go biology pre-med or go nursing, but as you can see, there are a lot of different options for you. And now, as you can see, it's going to vary a little bit between school to school, but not all of these programs have immediate admission. So as you look, like, since I'm from Georgia Southern, I will use us as an example. If you decide that you want to come to Georgia Southern for our nursing program or our respiratory therapy program, it is not as simple as going online and checking that as your major and starting. Lots of our programs have dual admission or secondary admission, meaning that first you would need to apply to our school, get accepted to that, and then later on you would apply to that actual program. So as you can see, there are a lot of 2+2 programs, and that's kind of going to be the same with a lot of these. So I'm looking through one really thing, and I don't know, I might let Sage talk on it a little bit more, but I thought it was super cool as well to see that in Mercer's program, they do have the option to kind of complete that while doing clinicals at all of these different hospitals, which is really neat. But yeah, I know a question for those of us in admissions that we do get a lot is, oh, I applied for this program and I'm not in it yet. So with you guys coming in as freshmen, you may start off as like pre-nursing or maybe even be assigned a different major altogether. Like at Georgia Southern, you're assigned to exercise science until you're actually accepted into your program. But yeah, and if anybody else wanted to hit on theirs a little bit.
Yeah, thanks for the shout out there. Yeah, our nursing program is a 2+2 program here. And the cool thing about it is I know a lot of universities have nursing 2+2 programs, but ours is in 2 different locations. You do your pre-nursing here in our Macon campus with all of our other traditional undergraduate students. And then once you are admitted into nursing school, you can actually, you'll transfer to our Atlanta campus. So you'll be smack dab in the middle of the city, right by the CDC. And we're one of the only 2 nursing schools in Georgia that are allowed to do clinicals with CHOA, which is Children's Hospital of Atlanta. You're gonna have a lot of opportunities, which is cool. That's why I always thought it was cool, because where I went to school, it was a 2+2 at the same location. So that's just a fun thing to look for. And yeah, be aware of secondary admission because that can trip a lot of people up.
All right, well, cool. That was really a very brief overview, a little bit about the health professions, a little bit about all of our programs, and really and truly a lot of that information y'all could have found on our website. So the main reason that we are here is to get to answer those questions for you, share our contact information. I would definitely encourage all of y'all to screenshot, take a Snapchat of that, just in case you do need to get in contact with us later. But yeah, really what we're here for right now is to get to answer those more specific questions and have a little bit of one-on-one time with y'all. So I'm going to keep this up just so you guys will be able to have our contact information. But if one of my other lovely panelists would maybe like to start looking through our questions and take the lead on that, then yeah, we can start answering those.
Okay, we've got one question. What is the process of becoming a ENT doctor starting from high school? So undergraduate, MCAT, med school, etc.
That is a great question. I think every student's path is going to be a little different, especially once you get into the specializations. So for the start of that is just your undergraduate degree. Again, getting prereqs for med school, majoring in whatever it is you decide to. Common ones are, biology, molecular biology, chemistry, biochem. Those types of majors are very common. But again, as long as you're getting the prereqs for the med schools that you're looking for, that's all that really matters. Then your next step, again, taking the MCAT. Different med schools have different requirements for the MCAT, as well as different programs that you're looking to get into. And then going into med school, this is where you'll do a lot of your specialization. It's not really something that you'll start with now, but it is something that you'll get into once you get into med school. And then once you enter residency, that's really where a lot of that occurs when you get into your specializations. So you are at the very, very beginning, and I just recommend going ahead and doing your research. Look at the different med schools that you're interested in. Getting in contact with your advisor once you get onto your campus as a freshman. Stay in contact with them. Let them know your plan, because they're going to be helpful in connecting you with internship opportunities, clinicals, job shadowing opportunities for you to get a real feel of it and get to know other ENT doctors. Kind of figure out their pathways, because they're going to be your best resource in finding out what's going to be the best path, what's the easiest path. Not that any of them are easy, but you know what I'm trying to say.
Okay, we've got another question. What undergraduate degrees would I need to for veterinarian school?
That is a great question, and kind of one that we didn't touch on when talking about all of the different health professions. So super great question. And I can't speak for every school, but I know at Georgia Southern, we do have a veterinary medicine track. And so with that, you can still kind of choose your major, whether that's going to be like an animal science or a biology. And so you could start with your undergrad there, and then because we are able to kind of offer that pre-veterinary medicine, we're making sure that you are getting the courses that you need in undergrad to go on to veterinary school. Now, I don't know if anybody else had some other undergrad or anything that they offered for future vets that they want to hop in.
ETSU does something really similar. You can major in almost anything you want to as far as veterinarian school is concerned. And we give you an advisor through that program. So they're there to make sure you're signing up for classes on time. You're doing everything you need to do to graduate on time. But we also give you a pre-vet advisor. So it's an additional person that's just in your corner to make sure you're doing all the correct prerequisite classes. They're making sure that you're doing stuff that can help you stand out on your application or your resume. And then when the time comes, they can actually help you through that process. So I'm sure other schools do something very similar, but that is a nice resource to have. Got another question, and it says, are we going to learn the information we needed for the MCAT in the undergraduate school, or do we need to learn the information we need outside of the undergraduate school?
That's a good question. I know a lot of people don't talk about what's on the MCAT, similar to all these other standardized tests that we have to take at different points. So most of the information you will learn in your undergraduate classes. It's a part of the, general education that you learn in your prerequisites. So, your biologies, your organic chemistry, all of those types of classes that you're going to need for medical school. Now, you will have to additionally study outside of that, just because you'll take these classes in a 4-year span for a test that you'll take your senior year. So it's important to not only take these classes, retain that information, but also study beforehand. But most of the information you will learn from talking to students who have taken the MCAT and gotten into medical school you'll learn a lot of it in the undergrad. You just need to study and be prepared for the exam, similar to the TEAS exam for nursing or GRE for a general graduate school admission. So it just depends, and you need to study and take those classes.
Does anyone have advice on the best way to research schools?
Yeah, so there are a lot of different resources when it comes to trying to decide what school you want. Obviously, you want to find a school that has the program you need. And I would definitely encourage you guys to use resources like the College Board. They have a really great tool. But yeah, I mean, just kind of figuring out certain things that you want, big things. You know, what do you want to be in a big city or a small town? Are you looking for a big campus or a small campus? Really, there are so many colleges and so many options that you guys can kind of have your feel. So I would say if you know a program you want, you can start looking for those and then kind of start doing a little bit more organization. So, you know, if you know that you want to be in a small town and studying to be a vet or something like that, you can kind of start weeding out your options. Definitely looking into, I mean, all across the country. So like, definitely don't have to stick just in the Carolinas. As you can see, we do have some out-of-state reps here to talk to y'all about our program. So seeing what out-of-state schools have great incentives for students to come there. I know at Georgia Southern, we have something called the Border State Waiver. So residents of the Carolinas can come to Georgia Southern and pay in-state tuition. So you have to look at everything in college, which is a big thing. What do you want campus-wise? What do you want city-wise? Financially, what kind of school are you looking for? But definitely play around with all of those factors. But truly, there are so many different colleges and choices for y'all that you can really have whatever college experience you want, which is super cool.
Okay, we've got another question. Are you required or do you suggest to take the SAT subject test if you want to be in the health sciences?
I can take this. So I can only speak for our programs because I don't know everyone's. Mainly, I don't recommend it because it's not required, especially since a lot of universities have opted for test optional policies this year. Again, I can't speak for everyone, but we have adopted a test optional policy for the next 3 years. So not only do we not require SAT tests, and we don't require subject tests, it does not affect your admission nor where you're placed for classes. And then when applying to grad school and professional school, they don't ask about your subject tests. As far as I have seen in my own process, as well as friends and colleagues. So mainly, if you want to, go for it. No one's telling you not to, and it's great practice for those subjects and those areas. But for our school specifically, for any of the undergraduate degrees, it is not required. Most of the graduate programs have their own standardized tests that they require for admission.
And I'll hop onto that with Georgia Southern as well. We are also test optional for our incoming freshmen, so really no need to do any of that. And kind of what I was touching on earlier with having a kind of secondary admission program. Really what our programs are looking for is the work that you've done your freshman and sophomore year of college so far. So by the time that you're trying to enter the nursing program or a radiology program, we're not going far back enough to ask about what tests you took when you're in high school. All of those things are great getting into college, and then kind of once you're in college, the slate's wiped clean a little bit and you're starting over again. So yeah, and definitely if anybody else wants to hit on their school.
And ETSU's very similar. We're test optional for the Fall 21 applicants too, so we don't require that for admissions purposes.
We are test optional at Francis Marion as well, and I would echo the others in saying that, you know, not necessarily recommend it just because it's not required. But we prepare you well through all of our tracks to go towards whatever, you know, profession you decide to go into.
And I'd like to jump on that just a little bit. I review our nursing applications for our Bachelor's of Science in Nursing program, and a lot of students are worried that they're not going to get in because they didn't get a chance to shadow a nurse when they were in high school. They didn't get a chance to take a health sciences course when they were in high school, and they think that they wouldn't even get in the nursing program. Or any other science or med school or anything like that, but that's not true at all. It goes back to the whole secondary admissions thing. We're worried about what you're going to do when you get into college, you know, what you make on what you earn in your anatomy courses, your physiology courses. If you didn't get to shadow a doctor or a nurse, or you didn't get to volunteer at a hospital when you were in high school, it's okay. You can still be more than eligible to be a part of the health sciences fields.
And do you think the test optional will be extended till 2022? For ETSU, I don't know yet, but we are for fall 21. And I do want to kind of piggyback on that. For admissions purposes, we're not looking at any of the standardized tests, but for some of our scholarships, we are still looking at ACT or SAT. So it doesn't hurt if you've already taken it to go ahead and send your scores in, or if you're planning to take it, I would go ahead and take it and try to do your best, because that can only benefit you at this point.
As far as if Georgia Southern will continue that, that is a little bit higher than my level of knowledge what we're going to plan to do. And I think, I don't know, at least in general, everybody's waiting to see what goes on in the world. But yeah, for our scholarship-wise and everything this year, we are not looking at test scores. They're going to be based just off of that high school transcript. And for scholarships, of course, we have essays, letters of recommendation, stuff like that. But no need for test scores. And we will see what happens next year, hoping that we find that out a little bit sooner than later. But yeah, to be determined.
Here at Mercer, I know I mentioned it before, we are test optional for the next 3 years. It's a new thing we're trying. So we should be test optional by the time you're applying. But for anyone who's curious, we are not looking at test scores if you don't want us to for admission and scholarship opportunities. I always say, if you were able to test, go for it, because it's definitely something that a lot of students need for in-state scholarships still. And I always say, if you're kind of stuck between sending them and not sending them, a good rule of thumb to go by is, if you feel that they're a good representation of your academic ability, go ahead and send them in, especially a test optional institution. If you feel that they're not, don't. That's the benefit of it. But yeah, so far we are for the next 3 years, and then we will reassess and see if we will continue.
And for Francis Marion, we have not made a decision on anything past 2021 yet, but I do, again, would like to echo what some of my co-panelists have said about sending in your scores, because of certain scholarship opportunities may require them. I know a couple of our bigger scholarships do. So again, it will only help you if you do have scores for the SAT or ACT, and they do reflect well upon you.
Okay, how do we find opportunities to volunteer in hospitals or be in summer programs for colleges as a high schooler?
I can speak on finding some opportunities to volunteer in hospitals or shadow doctors, those types of things. So from personal experience and talking with a lot of students, a lot of people were able to by simply asking, calling the hospital, calling a doctor's office, asking to see if they've available, especially now, availability for you to shadow or volunteer, any opportunities that you can take advantage of. you have to ask. They're not going to come to you and say that they need volunteers. So definitely reach out to the local hospitals in your area, doctor's offices, clinics, whatever it is that's near you that you're interested in. Go ahead and reach out and see if there's any aid that you can provide.
And do some research. If you have a short list of schools you're interested in, then they could offer summer camps. For instance, ETSU, we have a really big pharmacy camp during the summers, and we do other health science or health related summer camps. So if you know of some schools that you're interested in, definitely check out their websites and see what they have to offer as far as summer camps go.
All right, so if we are all done, and I will share the screen. All right, thank you everyone for joining us today. When you close this window, there will be a link to a very quick 4-question survey. We would really appreciate any feedback you can provide today. This is just one of the many different sessions happening, so be sure to sign up for additional sessions at CACRAO.org. In about a week, you'll be able to find this session's recording as well as the other sessions recording at CACRAO.org. Have a great day, everyone.